Hey there, and welcome to This Explainer. I'm absolutely thrilled you're joining us today because we're tackling something that affects millions, yet it's still so frequently misunderstood. We're going to completely demystify gout treatment. If you or maybe a loved one has ever dealt with this, you know exactly how helpless it can make you feel. But stick with me, because by the end of our time together, we're going to put you right back in the driver's seat of your health with a clear, super easy to understand roadmap. So let's jump right in.
Picture this. Actually, maybe you've even lived it. You go to bed feeling totally fine, right? But then you wake up in the middle of the night with just agonizing, unbearable joint pain. It's so severe that even the weight of a tiny light bedsheet resting on your foot feels like absolute torture. If that sounds familiar, man, I want to validate your experience right now. That sudden explosive pain, that is the hallmark of a gout flare-up, and it is incredibly intense.
What you see here is the classic presentation of an acute gout attack. Notice that severe redness and swelling localized right there at the base of the big toe. Now, the medical world uses a pretty fancy term for this, podagra, but honestly, we can just translate that simply to big toe gout. When you look at that angry red joint, I want you to think of one word: fire. That joint literally looks like it's on fire, and chemically speaking, it basically is. Keep that fire metaphor in your back pocket because it's going to be the absolute key to understanding everything we talk about today. Okay, so here's our game plan for today. First, understanding your gout diagnosis. Second, calming an acute attack. Third, managing long-term gout prevention. Fourth, the golden rule of gout. And finally, lifestyle changes that actually help. Section 1. Understanding your gout diagnosis, the kindling and the fire. Really, it all comes down to this one thing: uric acid. Now, uric acid is just a normal chemical floating around in your blood. But sometimes your body either produces way too much of it or your kidneys just don't clear enough of it out. That high level is what we call hyperuricemia. Now, here's the kicker. Having high uric acid isn't actually gout on its own. Think of uric acid as the kindling for a fire. You can have kindling just sitting around without a fire, but eventually, if that kindling builds up enough, it starts forming these sharp, microscopic, needle-like crystals right in your joints. And those crystals, they are the spark that ignites the painful fire of a gout attack. So what's really interesting and honestly a bit staggering about this is the natural progression of the disease. If you just grit your teeth, suffer through that first painful fire, and do absolutely nothing else, well, what happens? The data shows us that a whopping 60% of patients will suffer a second attack within just the first year, and 78% will have another within 2 years. You see, gout is a progressive disease. Without the right treatment, it moves into this frustrating cycle of intermittent attacks and remissions, which eventually leads to a chronic destructive phase. And we definitely don't want that. Section 2. Calming an acute attack, putting out the fire. When that fire hits, you need fire extinguishers. First, let's talk basics. You've got to rest the joint, elevate it, and grab some ice packs just to take the edge off. But the real heavy lifting, that's done by specific medications. The primary therapies are NSAIDs, which are just strong anti-inflammatory drugs, and a medication called colchicine. And if those aren't a good fit for you, your doctor might suggest glucocorticoids, which are steroids. But here is the real secret to these extinguishers. They are most effective when you start them promptly. Ideally, we're talking within the first 48 hours of your symptoms popping up. You want to suppress that pain and inflammation immediately, right before the fire really rages out of control. Section 3, managing long-term gout prevention, clearing the kindling. Okay, listen closely because this is probably the single biggest point of confusion when it comes to gout treatment. We have to completely separate our fire extinguishers from our kindling clearers. It's absolutely crucial. Acute relief meds like NSAIDs and colchicine do absolutely nothing to lower your uric acid. Nothing. They just put out the fire. To stop future fires from starting, you need long-term prevention drugs like Allopurinol or febuxostat. These are your kindling clearers. They actively lower the uric acid in your bloodstream so those sharp little crystals simply cannot form in the first place. But timing is quite literally everything here. You cannot, and I repeat, cannot, start a kindling clearer while the fire is actively burning. If you're in the middle of a gout attack, the medical guidelines are super clear on this. You should wait 2 to 4 weeks after the acute flare completely subsides before starting a drug like Allopurinol. Why? Well, because shifting those uric acid levels around while your joint is already inflamed can actually mobilize more crystals, which can prolong or even worsen your current attack. No way we want that. So put the fire out first, wait, and then start clearing the kindling. Section 4. The golden rule of gout. Do not stop. Do not stop allopurinol during the acute attack. Seriously, if there's one thing you take away today, let it be this. So the crucial point is this. Let's say you've been a stellar patient, right? You waited after your last flare, you started taking your daily allopurinol to clear the kindling, and then out of nowhere, boom, another fire breaks out. Honestly, it happens. But whatever you do, do not panic and do not stop taking your allopurinol. You've got to keep taking it at the exact same dose. Suddenly stopping or changing your preventative medicine during a flare is essentially like throwing a bucket of gasoline onto the flames. Keep the kindling clear steady and reach for your fire extinguishers, your NSAIDs or colchicine to treat that new pain.
Section 5. Lifestyle changes that help. Your daily action plan.
Now, before we even touch on diet, you need to know your destination number, and that is less than 360 micromoles per liter. Or if you have severe gout, less than 300. Now, don't worry too much about the complicated medical units. Just cement that target number in your head. When your doctor prescribes a cleaning clear like allopurinol, they aren't just guessing. They are carefully tweaking your dose to get your blood work below this exact number. Because when you're below this target, gout attacks become very, very unlikely. You are officially back in the driver's seat of your health. So how exactly can your daily habits help you hit that target? Historically, doctors used to put gout patients on these incredibly strict, punishing diets. But today, the guidelines tell us that while dietary changes aren't the primary therapy anymore, they still play a really vital supporting role. First off, optimize your weight. Getting to a healthy BMI just reduces the overall burden on your body. Second, try to reduce foods that are super high in purines because those break down into uric acid. That means cutting back on red meat, oily fish, and shellfish. Third, restrict the alcohol. Beer, in particular, is a huge risk factor for sparking a gout attack. You also want to cut out high-sugar, fructose-rich drinks. But hey, here's a fun addition. Drink low-fat milk every day. It's actually a natural uric, which is just a fancy way of saying it actively helps your kidneys flush out that uric acid kindling. So, I'll leave you with this one question. Are you ready to clear the kindling and extinguish your gout flares for good? We have covered a lot of ground today, but I hope you can see that the path forward is pretty clear. By separating the drugs that put out the immediate fire from the drugs that clear away the uric acid kindling over the long term, a pain-free future is completely possible for you. Remember the golden rule. Work closely with your doctor to hit that target number and take charge of your lifestyle. Thank you so much for joining me for this explainer, and hey, here's to your healthy, pain-free joints.